Over 37 million Americans have type 2 diabetes, and millions more are being treated for it right now, with medications, with insulin injections, with drugs that their doctors say will keep them safe. But Dr. Jason Fung, a nephrologist with a fellowship from UCLA, a New York Times best-selling author, and one of the world's leading experts on metabolic disease, says something that should stop every diabetic in their tracks. The most common treatment for type 2 diabetes isn't fixing the disease, it's making it worse. In this video, we're going to break down exactly why Dr. Fung says that, what type 2 diabetes actually is at its core, why decades of standard treatment have been aimed at the wrong target, and what his research says can actually reverse it. But to understand why conventional treatment is failing, we first need to understand what type 2 diabetes actually is, because most people, including most patients, have it wrong. Here is what the medical system has told people about type 2 diabetes for decades. Your blood sugar is too high. We need to bring it down. Here is a medication to do that. That sounds logical. But according to Dr. Fung, it misses the entire point. In his book, The Diabetes Code, Fung lays out a framework that completely reframes what type 2 diabetes actually is. It is not, at its root, a blood sugar problem. It is an insulin problem. Here is how Fung explains it. Think of the cells in your body like a container. Every time you eat, especially carbohydrates, blood glucose rises, and insulin is released to move that glucose into the cells for storage. This works perfectly when it happens occasionally. But when it happens repeatedly, meal after meal, year after year, the cells become completely full. They are overflowing with glucose, and when a container is full, nothing more can go in, so the cells begin resisting insulin's signal, not because something is broken, but because they are protecting themselves from being pushed past their limit. This is insulin resistance. And according to Fung, it is not a malfunction. It is the body doing exactly what it is supposed to do. The problem is what happens next. The pancreas sees that blood sugar is still high and responds by pumping out even more insulin, trying to force glucose into cells that are already full. Insulin levels in the blood climb higher and higher. And that chronic state of high insulin is, according to Fung, the actual disease, not high blood sugar. High insulin. The high blood sugar is just the symptom. So here is the question that changes everything. If too much insulin is the root cause of type 2 diabetes, what happens when the standard treatment is to prescribe more insulin? This is the core of what Dr. Fung has been arguing for years, and what made his work so controversial when he first published it. For decades, the standard medical approach to type 2 diabetes has been to lower blood glucose, with oral medications, with insulin injections, with drugs that push glucose out of the blood and into the body's cells and organs. And here is what Fung observed firsthand as a nephrologist treating diabetic patients. Their blood sugar numbers improved, but they gained weight. Their insulin resistance worsened. They developed heart disease, kidney failure, nerve damage, and blindness. The number on the test looked better. The patient kept getting sicker. Fung's explanation is direct. These treatments lower the symptom, blood glucose, without touching the underlying disease, hyperinsulinemia. In fact, by adding more insulin into a body that already has too much, the treatment actively makes insulin resistance worse. He writes in the Diabetes Code that treatments known to actually reverse type 2 diabetes, fasting, low carbohydrate diets, and bariatric surgery, all share exactly one thing in common. They lower insulin, not blood sugar, insulin. That single insight is what separates managing the disease from reversing it. Now that we understand what is actually driving type 2 diabetes, the question becomes what Fung's research says you can actually do about it. Fung's framework for reversing type 2 diabetes comes down to two levers. Both work for the same reason. Both lower insulin. And both have been used successfully in his clinical practice with thousands of patients. Lever 1. Remove the dietary inputs that spike insulin most aggressively. Refined carbohydrates and added sugars are the primary drivers of chronic insulin elevation. Every time they are consumed, blood glucose spikes, insulin follows, and the cycle that drives insulin resistance deepens. Fung's approach is not about counting calories or eating less. It is about removing the specific inputs, processed carbohydrates, sugary foods, refined grains, that keep insulin chronically elevated. His patients at the Intensive Dietary Management Program in Toronto follow a low-carbohydrate, high-fat diet as the dietary foundation. The goal is simple: keep insulin low enough and long enough that the body begins drawing down its glucose stores rather than continuously adding to them. Lever 2. Intermittent fasting. This is the tool Fung is perhaps most associated with, and the one that generates the most resistance from conventional medicine. The logic is straightforward. When you eat, insulin goes up. When you stop eating, insulin goes down. Fasting creates extended windows of low insulin that allow the body to do something it cannot do in a constant state of feeding: actually burn through the excess glucose stored in the liver and the cells. Fung has described patients in his clinic who were on multiple diabetes medications and insulin injections, who, within months of combining low-carbohydrate eating with intermittent fasting, were able to come off their medications entirely, not managed, reversed. He is careful to note that this should only be done under medical supervision, particularly for patients already on insulin, where fasting without adjusting medication can cause dangerous drops in blood sugar. But the principle is clear: lower the insulin, empty the overflow, give the body the conditions it needs to recover. Here is what Dr. Fung's research ultimately shows. Type 2 diabetes has been treated as a blood sugar disease for 50 years. And in those 50 years, the rates of diabetes have climbed steadily. The medications have multiplied. The complications have continued because the symptom was being treated, not the cause. The cause, chronic hyperinsulinemia driven by diet, was never addressed. And according to Fung, once you address it directly, the body has a remarkable capacity to recover. The pancreas is not burned out. The insulin resistance is not permanent. It is reversible, in many cases completely. Based on Dr. Fung's published research and clinical framework, here are 3 places to start. 1. Talk to your doctor about getting a fasting insulin test, not just fasting glucose or HbA1c. Understanding where insulin levels actually stand is the starting point for addressing the real disease. 2. Begin reducing refined carbohydrates and added sugars. This is the single most direct dietary lever for lowering chronic insulin levels, and the foundation of Fung's clinical approach. 3. Research intermittent fasting, specifically time-restricted eating as an entry point. Even a simple 16-hour fasting window creates extended periods of low insulin that begin to shift the metabolic environment. Always consult a doctor before starting, especially if currently on diabetes medication. Type 2 diabetes has been called a chronic, progressive, irreversible disease for decades. Dr. Fung's work, and the patients he has treated, tells a different story. The disease is dietary, the solution is dietary, and for millions of people still being told their only option is more medication. That distinction may be the most important thing they ever learn.